What's up, everyone? Medical Device Matt, day 3. Really excited to talk about today. I go to a competitive account and I want to talk about my strategies there. And then I go to my a Loyalist account, or an account I really enjoy to be in. What I mean by that, it's an account that has worked with me for a while. I know all the lab. The docs are awesome. They know my product really well. And we have high market share. And that's good and bad, right? Because it's an account you have to water and nurture and take care of and keep them growing, right? And keep them protected from the competitors trying to break in. And you just assume that business is yours, but really, that's not the case. I'll tell you why. Because you have competitors eyeing to get in there, trying to find ways to partner with your physicians, the hospital on pricing, the economic narrative, trying to get partnerships with industry so that these competitors could get in. So a lot of the past 2 days I talked about competitive accounts where I'm the hunter and I'm going in trying to break and take a couple cases and grow my business from 0, 15, 20, or 30% market share. And then now we're going to talk about an account where we have, we'll say high market share. We'll say, higher than 60%, right? And that's important because a lot of territories you're going to have a mix of accounts where you have accounts where you're hunting for business, trying to break in. And once you break in, you're trying to grow your market segment. Or you're also going to have loyalist accounts. And sometimes at those loyalist accounts, or even competitive accounts, you have KOLs or key opinion leaders who are involved in a lot of research and support and provide a lot of evidence for your device or kind of the cardiology space or whatever the space is. So first I want to talk about the competitive account. I do want to point out my silly hat. That's a bouffant. That's what you have to wear in the OR. And I think, let me see if I have, yeah, hey, sometimes they give you these red ones. I don't wear these. They make other vendors wear them. I sneak in. I just look like a grumpy doctor and try to get by everyone without making a scene and get to my safe spot in the cath lab. But those are bouffants. And before I talk about the competitive and loyalist account and my strategies, I did want to talk a little bit about my territory, which I haven't explained well. So I don't take flights. I drive to all my accounts. In the beginning, when I first joined, I was flying to cover cases for training. So I would join my team members and colleagues across the United States to see the specific TAVR that I was going to be selling, right? And that was awesome. Now, 5.5, 6 years later, the volume's a lot higher in our local area. So if you were to get hired by our team, you could do a lot of your local training. But in general, with a lot of med device, they don't want you training in the territory. They don't want you really working with the doctors that you're going to be covering for many different reasons. But the big reason is they want you to go into other safe territories where you can learn, ask questions, make mistakes, and grow from them, right? So my territory is, I don't know, maybe 100, 120 miles up and down, and it's narrow because I'm on the coast. So a lot of my buddies who cover LA or OC cities in California, it's a very dense population. So you could skip or throw a rock from hospital to hospital and be in a new set of customers and docs. I drive a lot. So a lot of my days are spent driving, which has its perks and it has its disadvantages. I have a lot of time to listen to music, podcasts, call friends, take work calls, connect with people trying to break in. But I also sit in the car, and when you're like a wild animal caged in a car that kind of looks like a aquarium, you get a little intense. So I try to have good ergonomics, try to stretch. I also try to maintain exercise every single day. So I'm going to talk about my competitive account, and then let's talk about the loyalist account, which is kind of a new idea. So the competitive account is an account that I've been trying to break in, and we have got our claws in a little bit, but we're trying to pick up steam. So what was awesome is I had a physician that's been very loyal and supportive of me because they believe in our product, who is at a different hospital. And for whatever reason, sometimes it's insurance of the patient, sometimes it's politics, sometimes it's scheduling, or sometimes there's little tit-tats with the admin at different hospitals. He scheduled a case at a competitive account, which was awesome, right? Because it does a couple of things. It allows me to get into that competitive account and meet the cath lab, work with the manager, the service line directors to get all the contracts approved because we have a clinical champion that's bringing a case. It makes things and facilitates so much easier. And then once we're there, we were joined by the competitive doctors so they could observe this valve. And that gives me the opportunity, one, to, they saw a case or a surgery that was flawless. It was under an hour, which is, below or faster than expected time. We had a really great result, and they saw how easy it was, right? And then after the case, I'm able to connect with the doctor that's provided lab support to make sure he was happy, make sure we're continuing to support and growing him. And when I was done having conversations with him, I was able to go up to the competitive doctors or competitive administration and talk to them and remind them about the Matt Abrams brand, which is, really good service, clinical outcomes, and all that fun stuff. And in those conversations with the competitive doctors, I could hear what their concerns are or what I need to do to address, right? So in that day, I'm not going to solve these concerns, right? I'm not going to, I can provide, and I have my talk tracks down so I can address them then, but there's some bigger concerns that I now am aware of, right? And these concerns could be procedural comfort, familiarity, maybe as they don't believe in our product. So I could go to the drawing board and I could devise a strategy of how I'm going to get into these accounts. And for example, what I can do is I could talk to the physicians and the nurse champion and think about, hey, listen, you guys are fantastic. I understand what you're doing. You've built an amazing program, but there's a certain segment of patients that I really believe my product can help. I'm not asking for all your business, but I would love an evaluation for these certain patients, and I'll help you identify them, right? And not only that, but I want to make sure you guys are comfortable, and I'm going to work with you for the ease of use so that when you do this case, that you don't notice any hiccups and it goes smoothly, right? Because one of the worst things is when you're not in accounts and you're trying to break in, all of a sudden it's like the mat day, you're using your product for the first time. It's super exciting and it's a big deal, but sometimes people make it such a big deal that they'll have 20 physicians in the room and it's just not a big deal in the right way, right? Like, our product's good, it's safe, and it's huge to celebrate when you could offer patients 2 different options, 3 different options. But sometimes, you don't want them to feel like it's so crazy that they need to bring in the whole armed forces. So that was a competitive account. And with competitive accounts, I got lucky that I had a physician go in there that was a big supporter of Matt, and it gave me the opportunity to go in and work my sales angle, right? The other competitive accounts, I didn't have that, so we'll talk about that in the future, but I had to really buy and find a clinical champion within the internal hospital. And a lot of times it's doing what I just said, but it's identifying a certain patient population and improving those clinical outcomes. So after finishing at the competitive account, we drove, right? And you can see in my car, I got my bags, I got my trunk. It's basically the size of a snowboard or a ski bag, right? So my whole trunk is valves and catheters, and that is typical of med device. Your car is your office. So I obviously got my laptop, I got all my product, I got accessories that are not even my company's, but wires and balloons just in case if we need them, because I never want to be in a bind. And we're going to my Loyalist account. And a Loyalist account I talked about, but it's usually a place that is supportive of you, your product. They believe in your product, and it has high market share, right? And it's good to have these in your territory because you could ask them more honest questions. You could talk about your product, about this, the cardiology field. You could even ask them about other customers or practice your talk tracks with them, right? You got to be respectful of their time, but every couple quarters or a quarter monthly, there's new data. And going to your Loyalist accounts can be good to talk about that data and get their thoughts, right? Because sometimes data comes out that's very supportive of your device, but if you look into it, you're like, well, this seems like the Kool-Aid, right? This was supported by the same company that makes it, I don't know. So by talking to your Loyalist, you get a good idea, right? And maybe they're like, yeah, this is actually really good data, and they'll tell you something that they found impactful, because you might go in thinking, hey, I saw that mortality was better because of this, and then they might say, hey, yeah, I don't know, we'll see how it plays out, but what I found really impactful from the study was actually this part. And then all of a sudden, when you go into the other conversations with more competitive, hostile physicians that are going to challenge you, you have more to talk about, and you already practice your talk track. And what's great about Loyalist account, it's like a sponge. We could absorb a lot of complex cases and do good results. So I try to leverage and grow the market at these accounts, right? We have fought for market share. We're high market share. So the question is, how can we grow these accounts or support these programs and do more cases? And I like having these accounts. I like both types of accounts. I like hunting, trying to break in, and I also like managing and and growing internally these kind of bigger Loyalist accounts, but you cannot take it for granted. And what I mean by that is if you turn your back on these large volume Loyalist accounts and neglect them, and your service isn't good, or you're having product issues and you're not addressing them after, or politically you're maybe snubbing them on different things, those accounts can change because there's someone on the sidelines waiting for you to make a mistake, and they are selling their value proposition of why they should be joined with your account. And maybe it's not all the business, but maybe they're trying to do what I'm trying to do at the hunting accounts, right? They're trying to say, hey, listen, I respect what you're doing, but we're just trying to move over 10 to 20% of these specific patients, and we want to partner with you in these different ways. And that's attractive. So you had to be on the defensive all the time to protect that business. And a reason that it's important is a lot of times your AOP or your revenue plan, you're assigned a revenue. So let's say Matt Abrams assigned $1 million for 3 months, a quarter. A bulk of that is expected to come from your Loyalist account. So if you lose a Loyalist account that's providing you with 70% of your goal, the number's not really going to get fixed for probably a cycle or two, meaning a year or two. So you're expected now to go make it up at your growth accounts, which is going to be a huge challenge. So I'll give it to you. Growth accounts, your competitive accounts, and your Loyalist accounts all are different challenges, and that's what's great about being in med device sales, right? You have to incorporate different strategies. And even with some devices, like some reps hop from companies because they want to be launching accounts. They want to go from 0 to 1, and they want to change the algorithm, deliver a paradigm shift, and work with service line directors, the C-suite, to launch programs. And that could be, for example, now a big thing is renal denervation, which is to help lower blood pressure. So reps and those account managers are working with hospitals to develop their hypertension clinics and launch RDN, and that's really exciting. If you look back to TAVR, I was able to launch and partner with programs, so doing something similar, but maybe a few years before when a lot of accounts were looking to launch, you had account managers partnering with hospitals to build out the systems to launch TAVR, which is really exciting, really awesome. If a center is creating a stroke center, loop monitoring was huge. There's all these different kind of new products that you could join and you launch. Some reps like growing the business. So you're already in the business, you're established, and your goal is to grow within the hospitals. And that's awesome. Both reps could do well in either situation. Some reps prefer or have a better knack for a particular skill set. But yeah. So I'm fortunate to have a Loyalist account. I'm fortunate to have these competitive accounts. We had a really good case at a competitive account. I talked a little bit about how I leveraged that to maintain my relationship with my doc, but also break in and go talk to the other competitive doctors. I also talked about going to my Loyalist account where we had a couple great cases. And the inverse works as well. I might have competitive doctors on the outside, but when they come to my Loyalist account, I have built a lot of systems and infrastructure. So when there's cases that are toss-ups and they might use a competitor or my valve, I usually win in my Loyalist account. But I would lose that case in a competitive account. So I could gain business by getting my competitive doctors to come to my Loyalist account where there's larger influences and more drive to use our device, right? The staff is comfortable with me and my device. So this is day 3. When was last time we talked? Last time we talked, I talked about how I manage the schedule and prioritization, which can be difficult, but really it's just kind of makes sense. It's logical. Today we talked about a competitive account, but also going to my Loyalist account and the differences there. As you think about your territory and how you manage it, just remember that these are two big, kind of the extreme spectrums of market segments of your accounts. And I don't want you to, when I think of a Loyalist account, maybe I have 80% of business, but maybe if you look at the two physicians doing the implanting, I have 90% of one and then 40% of the other. So those two different physicians are going to take different strategies of how to grow their business or how to protect their business. So don't lump your physicians under the tag of the hospital or the account. You have to look at each individual physician to develop your strategy, but also understand the strategy of the account, which are two different things. So that is day 3, medical device mat. I got my blue bouffant on, so let's take that off. Let's rip this off. I don't need this anymore. Super cool. Everyone's watching. Take care. We'll talk soon.